Welcome to MedsTalk, where we break down complex medical concepts in the simplest way possible. Today's topic is IV fluids, one of the most commonly used and crucial interventions in hospitals and clinics worldwide. Whether you're a medical student, a nurse, or simply someone who's curious about health, this video will give you a solid understanding of what IV fluids are, what types exist, and when and why each one is used. Let's start by understanding what IV fluids actually are. IV stands for intravenous, which means directly into the vein. These fluids are sterile liquids administered through a drip to help maintain or restore a patient's fluid balance. They're used in various conditions like dehydration, electrolyte imbalance, trauma, infections, surgeries, and even to deliver certain medications. Now, IV fluids are broadly categorized into two main types: crystalloids and colloids. Let's talk first about crystalloids. Crystalloids are clear fluids made up of water and electrolytes or small molecules that can easily pass through blood vessels and into the cells and tissues. They're the most commonly used IV fluids and come in several varieties. The most familiar one is normal saline, also known as 0.9% sodium chloride. It closely mimics the salt concentration in human blood, which makes it ideal for general hydration, fluid loss due to vomiting or diarrhea, and for administering IV medications. It's isotonic, meaning it doesn't shift fluids into or out of cells dramatically, which is why it's considered safe and neutral for most situations. Next, we have Ringer's lactate, also known as RL, or lactated Ringer's solution. It contains not just sodium and chloride, but also potassium, calcium, and lactate. It's considered a balanced fluid and is often preferred in cases of trauma, burns, or surgeries, especially when a patient is at risk of developing metabolic acidosis. It helps maintain the pH level and supports electrolyte balance during large volume replacement. Then we have dextrose solutions, such as D5W, which is 5% dextrose in water. These solutions provide water along with glucose and are typically used in cases of mild dehydration or to maintain blood sugar levels in patients who can't eat. However, dextrose solutions should be used with caution in diabetic patients and not typically for resuscitation, because the sugar content can shift water into the cells, lowering blood pressure if used alone. Another type is half-normal saline, or 0.45% sodium chloride. This is a hypotonic solution used in patients who need rehydration but don't require a full sodium load, such as in some cases of hypernatremia or diabetic ketoacidosis. It's often combined with dextrose to balance the tonicity. All of these fall under crystalloids, which are inexpensive, easy to store, and suitable for most routine IV therapy needs. But in some critical cases, crystalloids may not be enough. That's when we turn to colloids. Colloids are IV fluids that contain larger molecules such as proteins or synthetic starches. These molecules are too large to cross the walls of blood vessels easily, so they stay within the vascular space for longer. This helps draw water into the bloodstream, making them useful in situations where a patient has lost a significant amount of blood or plasma or has very low blood pressure. A commonly used colloid is albumin, a natural protein found in blood. It's used to expand plasma volume in patients with burns, liver failure, or severe infections like sepsis. It can also be used in cases of low albumin levels or certain kidney conditions. There are also synthetic colloids such as dextran-hetastarch or gelatins. These are used for volume resuscitation in emergencies or surgeries, but must be used cautiously, as they can sometimes cause kidney damage or interfere with blood clotting. Now the big question is, how do doctors choose the right IV fluid? The answer depends on several things: the patient's condition, electrolyte levels, fluid losses, organ function, age, and whether medications are also being administered through the drip. For example, a patient with diarrhea and vomiting might get normal saline. A trauma or surgery patient may need Ringer's lactate. A diabetic patient with low sugar might receive dextrose. A patient in septic shock might be given albumin or other colloids. A dehydrated child with mild fluid loss may need a hypotonic solution. It's not a one-size-fits-all decision. That's why IV fluids should only be administered by trained professionals under medical supervision. It's also important to monitor patients carefully. Overuse or incorrect selection of IV fluids can lead to complications such as fluid overload, swelling, electrolyte imbalance, or even heart and kidney problems. To wrap it all up, IV fluids are a cornerstone of modern clinical care. They may look like simple, clear liquids, but each bag contains a powerful therapy that must be used thoughtfully and safely. If this video helped clarify your doubts about IV fluids, give it a thumbs up, share it with your fellow learners, and hit the subscribe button on MedsTalk for more clear, simple, and useful medical content. Thanks for watching. See you in the next video.